Hi, my name is Amber, and for my Toulmin argument, I have decided to research medical marijuana. Medical marijuana has been studied for many years. Those studies have proven that the use of marijuana has some very beneficial aspects to a few diseases, such as, but are not limited to, Parkinson's disease, cancer, and anxiety. Medical marijuana can decrease nausea. It can be used as a muscle relaxant. It can be used for appetite control and can manage chronic pain. The use of marijuana has dated back from 2900 BC. It was used traditionally for symptomatic treatment, therapeutic use, and recreational use as well. The DEA needs more physical evidence to deem medical marijuana legal. It was scheduled as a Character 1 drug in 1970 and remains the same today. But why? There are opiates that are destroying people's lives that are legal, causing people to become addicted, and some may abuse the drug and end up having a drug overdose. There has never been evidence proving that anyone has been admitted to the hospital with a drug overdose from marijuana. I believe the use of marijuana is a safer drug when it comes to medication for illnesses for our patients. Although there have been negative side effects found in the clinical trials with marijuana, the positive aspects far outweigh the bad. After all, every drug in the world has some type of potential side effect. A patient that is prescribed opiates is more likely to get addicted and need a higher dosage. A study shown that only 4.5% of medical marijuana card holders reported they needed a higher dose over time to help with pain. Opiate-related overdoses are one of the leading causes of preventable death in the USA, killing about 130 Americans daily. So again, I ask, why isn't medical marijuana legal? Today there are 36 states that have approved marijuana for medical use, and 18 states have approved marijuana for recreational use. In these states, it has shown a decreased amount of opiate drug overdoses since marijuana is accessible to everyone. I believe that if marijuana was legalized worldwide, we wouldn't have such an opiate crisis like we currently have. There was a study that found 65% of medical marijuana card holders discontinued at least one prescription or over-the-counter drug. Doesn't that speak to you? That speaks to me. I honestly hope that these studies of medical marijuana will continue, and the evidence needed to allow for this plant to become legal is found soon. Some people may say that marijuana is a gateway drug, but from my research, I can say otherwise. Like I said, only 4.5% of medical marijuana card holders reported they needed a higher dose and time for their pain. You could also say that the use of marijuana is bad for your health, and although there has been negative side effects found, there are far worse side effects from prescription medications that are legal that are prescribed to our patients daily. Side effects can include heart failure, stroke. Marijuana hasn't had any proven effects like a stroke or heart failure. So why is there more evidence needed for the DEA to approve the use of marijuana legal worldwide? To me, from my research, I can't understand why they would need more research on more clinical research for medical marijuana. I'm going to attach a chart, and it's going to have the deaths from opioids in America and marijuana. You will see that there has not been a death reported from marijuana, but there has been many for opiates such as heroin, pills. It'll be on the chart, and then I will also post a chart that shows that medical marijuana has helped with appetite, nausea. There's some things that it hasn't helped with, but I don't know. I just believe medical marijuana needs to be legalized. It needs to be available to patients. It needs to be available to people who need it. Anxiety. It can help. So I hope that my research can help you kind of understand why medical marijuana should be legal. Thank you.